So, in this presentation we will be learning more about home care. The presentation has been prepared by Colonel Dr. Yashwant Joshi, Vice President of National Association of Palliative Care for Ayush and Integrative Medicine. End of life palliative care patients are mostly bedridden and cannot come to an OPD of a hospital. Such patients will need to be cared for at a hospice or their homes. Since most of our patients prefer to be cared at homes, the need for home care is there. The aim is to address total pain of the patients and their caregivers as well. Here the caregivers may be family members, just to remind you. This is to improve the quality of life of the patients as well as their relatives and families. What is the total pain? Let us revise again. Not only the physical pain, but the pain may be in terms of social, psychological and spiritual pain. Lilian Walt is recognized as the pioneer of public health nursing. She established the Henry Street Settlement, which served underprivileged individuals and families. Nurses and social workers that worked at Henry Street Settlement visited patients in their homes, assessed their health needs and provided support with hygiene, nutrition, immunizations and more. Walt was able to convince Metropolitan Life Insurance Company to cover home care services too. This allowed public health nursing to shift from charitable work to profitable work. We can see the palliative care team discussing with the patient. The counseling is being done apart from assessing the physical symptoms. Home care team comprises of professionals trained in palliative care, which may be a doctor, nurse and a counselor. Doctor can be shared between two teams. Hiring, training and retaining these professionals are the real challenges, because there is not much money involved. MBBS doctors, GNM nurses are hired and are trained for 1 month. Counselors are trained for 3 months. The periodic ongoing trainings of the hired palliative care professionals is done, and after these professionals are on the job, they undergo on the job training 20 days full session in a year. The trainers can be our own trainers and guest trainers. Such training programs are to be prepared for every quarter. Ongoing training is crucial to ensure that home care teams are enabled to provide latest evidence based care. Let us understand the functioning of a home care team. Each team caters for an area of around 25 kilometers around their field center. The patient's referrals come through the premier cancer institution, the helpline of organization and word of mouth as well as online referrals. During the first visit, the case sheet is made. The first visit to the patient's home takes around 1.5 hours. The palliative care issues of the patient and the family are identified. These may involve medical, nursing as well as counseling. Urgent issues are addressed during the first visit itself. Let us understand the functioning of home care. The patients are categorized into high, middle and low priorities depending on the palliative care needs of the patients. The high priority patients are visited once, twice or even more often every week. Middle priority patients are visited once in a fortnight and low priority patients are visited once a month. These priorities are changed as and when required depending upon the needs of the patients. How does a home care team function? Doctors are available to the patients and their families on phones around the clock. Oral morphine is supplied free to the patients at their doorsteps for controlling their pain. As per law, only doctors are permitted to prescribe morphine and other drugs. Home care team manage medical, nursing and counseling issues too, and they refer the details below. Home care service, how big it should be? Big enough to cater for the promised care in a particular geographical area. Patchy home care service gives a bad name to the organization. What is the role of the hospital and networking staff? It helps us to get patients from leading hospitals. Monitoring of home care is done to ensure that quality of care offered is not compromised, and monitoring of activities of home care teams needs to be done regularly. Trained quality assurance executives needs to be in place. These executives call not less than 80% of the patients, caregivers and take their feedback on the visit of the home care team. The feedback call is made within 24 hours of the visit. The important feedbacks are shared with the home care director for corrective action. What are the official works of home care? Role of telephone helpline. It is window of the organization to the community and helps the organization to get referrals. It networks the patients and caregivers to other facilities like other NGOs, chemists, blood banks, prosthesis makers, etc. Morphine record is maintained by the doctor of each center on a daily basis. The record is maintained as per the advised NDPS Act. Morphine records are checked once a fortnight by the concerned organization, which in case here is KANPUR-NPTEL headquarters by the CMO of morphine. Quarterly morphine reports are sent to the state drugs controller, and documentation of the work. A case sheet of every registered patient is maintained by the team. Team nurse maintains a monthly master sheet which is daily maintained and submitted to the headquarter at the end of each month. After discharge or death of the patient, discharge or death summary is made by the team members and submitted to the headquarters. What are the advantages and disadvantages of the home care service? The comfort, privacy, security, autonomy, reduced focus on illness, closeness to the family and friends has an additive effect on the quality of life of care. Families actively participate in the caregiving process and are in control. Patient symptoms are managed holistically. The family's concerns can be addressed in a relaxed atmosphere and cost effective for the patient and the family. What are the disadvantages? Cost per patient is very high for the organization. Hiring, training and retaining palliative care professionals is really challenging. Remember, home-based palliative care is a recognized model of health service provision globally. Services offered included pain and other symptom control, counseling, training for carers at home, provision of bereavement services too. Earlier, the home care service was considered as a very effective tool in palliative care. This is slowly giving way to palliative care service in our own homes. At least one member in a family is trained as a volunteer in palliative care, and he is empowered to take the leadership when the question of caring such patients come up. Thank you.